Let me share the screen. Today we shall discuss about personality disorders. Now, there are so many personality disorders. Therefore, and we have only a 1 hour time slot today, so I won't be able to discuss the whole thing. So I thought of discussing the most important things today, and next part some other day later when we have another slot. Right. So in this lecture, we will discuss what personality is, and when do we call that personality has become disordered, and how to identify and treat certain personality disorders. We don't need to know how to treat all the personality disorders. And most importantly, how to tackle personality in our patient assessment when we do assessments in the wards and clinics. Now, when we talk about personality and when we try to describe what personality is, let me take a few examples. When you see this man, the characteristics that comes to your mind are listed on this side. He's funny and immature, and he's likable, competitive in a childlike manner. Those are his characteristics. He maintains these over a long period of time or over many circumstances. And this character, if you have come across him in a TV series, those who have seen Breaking Bad, he's ruthless, very neat, quite obsessive in his personality. Vengeful, hardworking, serious, those are the characteristics associated with him, and he maintains them over a long period of time, over many instances and circumstances. This character, when we see him, he reminds us of strength, intelligence, justice, and bravery. So these are characteristics associated with certain people and characters. When these characteristics are long-standing and we identify them, we recognize them as a pattern of behaviors, emotions, or thinking that signifies or characterizes a particular person, we can call it a personality trait. Now, for instance, strength or intelligence could be a personality trait in this person. Neatness or ruthlessness could be we call it a personality trait. And a combination of such personality traits is called somebody's personality, right? And different names are given for different combination of these personality traits. Now, if you take this as an example, there are some people who like to be the center of attraction. They want a lot of attention, and they behave in a quite seductive or provocative manner, and they are impressionistic. These are characteristics, and these personality traits collectively is called histrionic personality. When somebody has this kind of a personality, we call that they have histrionic personality, right? Now, how do we identify a personality? How do we identify that a certain person has this kind of characteristic? This is quite important because now when we deal with people in our day-to-day lives, it is good if we have an idea about their personality, how these people would behave with us when we interact with them. Are they friendly? Are they trustworthy? Are they deceitful? Do they empathize with us? That information is important for us to maintain a good relationship with people whom we meet for the first time, or meet those people we don't know about in day-to-day encounters. So one way of identifying a person, there have been different ways of identifying somebody's personality developed by many people over thousands of years. Now, this is one historical way of identifying personality. Now, in this method, they this author has attributed physical characteristics with some personality traits. Now, if a person has this kind of a physical build, he concluded that such people are determined and adventurous, and they have a balanced view of life and people. People who have this kind of physique or appearance are quite social, cheerful, but kind of lazy. Those are the attributes given by this person, this author. And now what I want to tell you is different people try to identify personality traits by different means. Now this is a Western example. Now in the East, in India, if you are familiar with this this poem, this is from Guttila Kavi. It was written in Sinhala in Sri Lanka, but the story is Indian. Now, when Musila came to Guttila to study how to play the veena, the teacher refused to teach him. Balamin Lakunugata Dudana Gunadana Hosita. Now he looked at the appearance and deducted that he is evil. So that was the same way of identifying personality traits by looking at the physical characteristics. And even today, the personality is assessed in jobs and in education. For example, in medical school entrance in certain countries, personality is assessed. Now, in Australia, they conduct these multiple mini interviews. One of the main ideas is to assess the candidates, the potential medical students' personality, whether they have empathy, whether they can work in a team without making trouble. So those are important when someone becomes a doctor, right? So these are assessed and marks are given. We don't do that in our country so far, but these could come up in future. And we assess personality by referee reports. When you go for a job, you are asked to provide a referee report by a third person, giving some account about your characteristics. So they usually write that you are trustworthy, hardworking, and so on and so forth. As medical students and doctors, for us also, it's quite important in clinical medicine because the personality of somebody can color the clinical presentation of an illness. Even when they don't have a personality disorder, somebody's personality may affect the way he presents or way he shows symptoms of a particular illness. Right? For instance, a paranoid person, a person with paranoid personality, with depression, when they become depressed, they might show the paranoid traits could be emphasized. Right? They could be quite paranoid, more paranoid than usual when they're depressed. So we might think that they are psychotic when they're depressed. If the underlying personality is, if the person has an underlying paranoid personality. A histrionic person, we will discuss what is meant by histrionic in this lecture. A histrionic person with a grief reaction, when they come up with a grief reaction, it might look like a manic episode because the grief in the histrionic, because of the histrionic personality traits. So you might sometimes find it difficult to diagnose certain illnesses when it is colored by the premorbid or background personality. That is one of the important things. That's one of the important reasons why we learn personality disorders, or even not even when they're not personality disorders. That's why we learn learn about personality traits, not to manage them or treat them, but to identify them when we come to differential diagnosis. So when we try to understand symptoms of mental illness. Today, we don't go by physical characteristics. We try to understand personality by their past behavior, what happened in the past. So we take a history and do a mental state examination, and we sometimes take a collateral history, ask other people about how this person was in the past. And based on that information, we conclude that this person has such and such a personality. When do we call that the personality is disordered? If you look at this chart, now these are on left hand side, you see certain personality traits. For example, some people could be perfectionist. They try to perfect everything they do. When it is not a disorder, when it is just a personality trait, he might describe himself like this. They take pride in what they do, what they're doing, and their functionality is not affected. If they have now, if they say, I feel I have to work on things until I get them right. Now, it's kind of it has gone a step further than this. Still functional. Therefore, we still don't consider it as a disorder. Now, when it comes to this stage, he can't stop working on something until it is perfect, even if it already satisfies what I need it for. So they might work day and night, and they can't stop working until they perfect it. And this could affect the functionality. And when functionality is affected, we call it a personality disorder. When when disorder is severe, they can't finish anything because they always have this feeling that they haven't perfected it. Right? They want to improve further and further and try and end up not finishing anything that they started. The same goes for other personality traits. When the simple thing that you have to remember is, when we call something disordered, when we call personalities disordered, when it is affecting the functionality. Now, in our psychiatric classifications, we have given names for different personalities, not only disorders, and we have classified them under 3 broad clusters: cluster A, cluster B, and cluster C, based on some common characteristics. Now, for example, cluster B personality, there are 4 types: antisocial, borderline, histrionic, and narcissistic. All these personality disorders have something in common, that is, they have an emotional inadequacy, emotional dysregulation, some problems with the regulation of emotion. And in cluster C, there is some problem with their behaviors. Now, obsessive compulsive personality, people with such personality, they are perfectionists. They try to perfect everything, and when it amounts to the level of a disorder, they become dysfunctional. Avoidant people would avoid social encounters. Dependent people will be dependent on somebody else for their function. So it's largely the common feature is something abnormal about their behaviors. Right? In cluster A, there is something odd about the way of thinking. In this lecture, I will mainly try to discuss about cluster B personalities and borderline personality disorder in detail, because that is the most popular and the one that we mostly encounter in clinical settings. And I will go through briefly about on the other personality disorders in cluster B as well. Now, if you go to details about borderline personality disorder, these are the characteristics that you see in borderline personality disorder. They have a persistent feeling of emptiness. They feel they are empty, emotionally empty. That is one of the main complaints, that they feel empty. They don't feel anything. Right? And they have an unstable self-image or sense of self. Now, what that means is, we have an idea about ourselves. We act in a certain way over different circumstances. Now, let's say if I am honest, let's assume that I am honest. I would act honestly when I deal with my friends, when I deal with my work colleagues, when I deal with strangers. I might act honestly, because honesty is a characteristic or as part of my self-image. I consider myself as an honest person, and I want to maintain that. Unstable self-image means they don't have an idea about stable idea about themselves. Let's say, for example, honesty. They might act honestly in certain situations, and not so honestly in certain other situations, based on who are around them, right? So there's no stability about their sense of their self-image. Okay, there's a question regarding cluster B personality disorders. Is there a unifying feature common in that cluster of personality disorders? Yes, the unifying theme of cluster B personality disorder is cluster B personality disorders is there is some problem with emotional regulation. Now, for example, in borderline personality disorder, there is emotional dysregulation. Yes, it is in this section you can see rapid mood changes. In other words, this is one way of expressing it. They have emotional dysregulation. Now, these personality traits or characteristics are interrelated. For instance, when they have emotional dysregulation, they might act impulsively. Or when they have emotional dysregulation, they might have problems with anger management. Or when they have persistent feelings of emptiness, they fear abandonment. Because if they're abandoned, they feel empty and they have to deal with it alone. So they fear a lot about being abandoned by loved ones. Therefore, their relationships are very intense. And it is quite difficult for the other person to deal with these people. And the unstable self-image also reflects in their social relationships. So these characteristics are interrelated, and you see a mixture of this and a lot of relationships between these characteristics when you see a person with borderline personality disorder. Now, I will give you an example, a clinical example. A 23-year-old woman is admitted after slashing both wrists when her therapist left for a week's vacation. Her usual therapist left for a vacation, and after that she harmed herself. The cuts were superficial. Patient says she was angry with the psychiatrist for abandoning her. Now this guy went on a vacation for a week, but the patient feels that she was abandoned by the psychiatrist. That rejection sensitivity, that fear of being abandoned is so intense and irrational. And as a result of that, they self-harm. Right? Self-harming is one of a key feature in borderline personality disorder. The patients could give different reasons for self-harming. Now, some people self-harm because they are impulsive. Some people self-harm because they feel nothing. They feel empty, and a lot of patients have told that they wanted to feel something, at least pain, because they don't feel anything. And therefore, that's why they harm themselves. Or to hurt the other person, to avenge other person, they might harm themselves. Or it could be due to suicidal ideations. After being abandoned, after thinking that they were abandoned, they might self-harm. Now, this patient claims that she's often depressed, although the depressions last only for a couple of hours. So that is the emotional instability. Right? They're not. To diagnose depression, we know that it should be there for a period of time, at least a couple of weeks. But this patient might claim they were severely depressed, but lasted only for a few hours. This is the fourth hospital admission after 3 days. Now, this is interesting. After 3 days in the unit, the patient's psychiatric resident, the trainee or the registrar, gets into an argument with the nursing staff. He says that the patient has been behaving very well, responding to his therapy, but The nurses, on the other hand, claim that the patient has not been following the unit rules. The patient was rude and was quite confrontative with the staff. Now, the parties don't agree, the nursing staff and the resident, and they go to the unit director to complain. What is this? This is, they have people with borderline personality disorder, they have a way of looking at people in a very black and white manner. Either they idealize someone. On the other hand, when they are angry with the same person, they will think he's the most evil person. Same person yesterday could have been the ideal person in their world, but the next day they could be rejected in a very dramatic manner. This black and white thinking is there. So these patients could react differently with different people. Now, with the nursing staff, they act very rudely, and the resident, they might act very charmingly and affectionately. This is, when you don't speak, please mute your microphones. There is some noise. I don't know where it comes from. Somebody's mic is on, I guess. This is self-harm behavior, superficial cuts, quite dramatic in this person. Now, you don't see this kind of people in our clinical settings, fortunately, but in some other countries, you may see this kind of patient. They have a repeated self-harming behaviors. And now, looking at this, you can't diagnose borderline personality disorder, but this is very kind of characteristic of borderline personality disorder or borderline personality traits. And you have to look for other features of borderline personality disorder. If you see this kind of scars or this kind of person. Now, in our clinical practice, in our wards, you may have seen teenage girls and boys sometimes come with self-cutting, and not to this extent. These people, these teenagers, may have borderline personality disorder if they have other features of the disorder, but they may not have borderline personality disorder as well, because a certain portion of people, especially when you are a teenager, in our settings, they copy these behaviors. For example, when they are in a relationship breakdown, they might self-harm. Could be a one-off thing, not repeated as in this person, because they have seen someone else doing the same thing. A classmate or a friend or somebody in the neighborhood does the same thing. They have seen them doing the same thing in the past, and after that, they came into good terms with their partner. When you self-harmed, your partner came back and the dispute settled. They learn it and apply it to themselves. These people may not have borderline personality disorder. Right? It may be just a copycat behavior. So you have to be careful not to jump into conclusions, seeing this, that somebody is having borderline personality disorder. How do you manage borderline personality disorder? The most evidence is for this thing called dialectical behavior therapy. It is aimed at reducing self-harm, suicidal thinking, and substance abuse in a person with borderline personality disorder. What they do is they train the person, teach the person certain skills in group and individual settings. For example, how to control anger. Let's say the person is having fights with their mother at home, and the therapist would teach them how to control anger or how to have a better conversation with their mother at home. And in the session, they might role play it and practice it to establish the skills in the person, and then homework could be given. So the patient is expected to apply that when they have the same situation again at home, when they have a conversation with their mother. If the mother is confrontative, they're given homework on how to apply the skills which were taught in the sessions. Quite effective in reducing self-harm behaviors. The problem is, it is very structured therapy given by psychologists. One session lasts for 2 hours, and it could last for the whole therapy session. The therapy thing could last for about 1 year. And in our settings, we can't afford doing this because we don't have trained therapist, and patient may not be able to afford it as well. Even in other settings, in richer countries, they say this is quite difficult to conduct practically, to have 2-hour sessions, intense sessions, weekly sessions for 1 year. It's not something easy. Therefore, this thing called good psychiatric management, or GPM, has come up recently. It also has evidence for borderline personality disorder. The advantage is it can be delivered by any trained clinician, a doctor or a nurse or someone in the setting who is trained in this. But what they do is they discuss the diagnosis with the patient and educate the patient. The idea is to give them some insight about the problems they're having. Right? So telling them that they have this problem called borderline personality disorder and discussing the symptoms with them might give them a lot of insight, because one bad thing or one particular thing about personality is any of us would be unable to look at ourselves. Now, I may not be the best person to judge my personality. The other people are better judges than me of my personality traits. So we find it difficult to reflect or look at ourselves, just like we look at our faces in a mirror. It's difficult for us to look at our personality traits, right? Because we usually focus on the other person and they focus on us, and they are better judges of our personality than ourselves. So telling the person that you have such and such a problem or issue could be quite insightful for the person with the problem, right? And then they help the person developing skills in managing life situations, for example, in work, just like in DBT. And medications are minimalized. Right? Medications don't have a big place in managing borderline personality disorder. So the minimum medications, and they work out safety plans, what to do in certain situations. For example, let's say the person is having frequent arguments at home with their parents. They will discuss, the doctor or the nurse or the therapist will discuss the activities to calm down, to help the person to calm themselves down in such situations. It's not very different from dialectical behavioral therapy. Only thing is, it's less intense, less structured, and it's delivered by general practitioners, the doctors, clinicians, the nurses or other clinicians with minimal training. This also is proven effective for borderline personality disorder. I will not go into details about other 3 personality disorders in this cluster. We will discuss the symptoms, signs and symptoms, because people with such personality traits, let's say antisocial traits, we might come across them in our lives, in our clinical practice, and their clinical presentations of other illnesses, depression or some anxiety or something, could be colored by the background personality. So antisocial personality is characterized by these symptoms. They are quite impulsive and they lack remorse. That means they don't feel sorry about what they did. They break the rules. They break the social norms. They don't show empathy towards other people. They make use of other people to achieve their ends, and they don't feel bad about that. Don't feel guilty about that. If we do something bad, we feel guilty, most of us. That's how we prevent ourselves from doing the same thing in future. And we sometimes go and apologize to people for being rude or doing something that we shouldn't have done, because we feel remorseful. We feel that we shouldn't have done that. These people don't feel remorse. Right? That's why they can do anything and sleep peacefully at night. And they don't learn from mistakes. Now, we all learn from our mistakes. We don't usually repeat the same mistakes for 10 times. We might repeat it for 2-3 times, but definitely not 10-12 times. We learn from our mistakes and correct our behaviors or change our behaviors. These people don't. Right? They lie, they can lie, and they can deceive people because they lack remorse. They don't feel sorry for doing that. Right? To achieve their ends, they will lie shamelessly, and they will deceive, they will steal from others. And some of them, dangerously, are superficially quite charming. This is sometimes called antisocial charm. They can be very polite and very attractive. They can be superficially very engaging in conversation. They will tell you what you want to hear. There are people who tell us what we like to hear, and we feel good about that. And these people, antisocial people, if they are intelligent enough, they can be superficially charmed, and they can be we can fall in trouble dealing with them because of these characteristics. They get charming, deceitful, they don't feel sorry, don't feel guilty. So if you take another example, as previously, this man is seen by a forensic psychiatrist. Now, these people end up with forensic psychiatrists most of the times because they break the rules, and they don't have insight, or they don't want to go to a doctor by themselves asking for help. They're referred by the legal authorities, prison officers, or through the courts to forensic psychiatrists. That's how they end up with forensic psychiatrists. This guy had a fight with another inmate in prison over 500 rupees, and he has been jailed for forging checks. This is the fourth incarceration, fourth time that he has been jailed. He said that he fought with the other inmate because he just felt bored, and I felt like doing it. Just dismissively, doesn't feel sorry for what he did. Admits that the 500 rupees was not really his. He stole it, but shows no remorse. These are stupid people who end up in the jails. Smarter people, intelligent antisocial people, they end up in other places. Could be in influential positions in government sector, private sector, in politics, and that is could be quite dangerous. So we need to be mindful about those personality traits. Management, again, is quite difficult because they don't engage, right? Because of the nature of their problem, unless they are brought by authorities. If you come across them, management is again discussing the diagnosis and educating, trying to give them insight. And CBT-based approaches have things like schema therapy have good evidence base, reasonably good evidence base, but you don't have to know how to do that and what it is at your level. Histrionic personality disorder. I showed the same slide earlier as well. These people, they have a sense of inadequacy about themselves. As a result, they want a lot of attention from others. And they behave in a certain manner to get attention. Right? They could be seductive, provocative, very impressionistic, dramatic, exaggerate themselves, right? Dress in a very extravagant manner. You might think if they are manic, but it is not something episodic like that. That's how they are. That's why we call it their personality. It is how they are throughout, right? And they think the relationships are closer than they actually are. So if your friend is having strong histrionic personality traits, you might fall in trouble. They may think that their relationship with you is actually more closer than it actually is. And they may show it off to other people, and you might fall in trouble. Right? And they're suggestible. easily influenced by others because they want attention and they like to be in the center of attention. To get attention, they might do what other people ask of them, their friends, immediate circle. So they might end up doing drugs, breaking other rules as well, to get, not with the same intention as antisocial people, but with the different intention, to get attention. I'm not going to discuss the management of this. These people are quite functional. You don't usually see them coming to clinics or wards asking for help. They're functional. They are employed, can do well in certain professions, right? Public relations, theater and drama, and in such areas. The problem is when they have relationship with other people, they can't have stable relationship. They have multiple short-lived relationships, frequent fights, and so on and so forth. Narcissistic personality is the other thing. Again, the main problem here is the sense of self-inadequacy. And to cover it up, they use this particular style of coping. They have maintain a grandiose sense of self-importance. They think they are very important people, and they show it and they tell it to the other people. Fantasize about unlimited success, power, etc. Right? Just like in manic grandiosity, right? Might talk about very extravagant things, but not episodic. This is their personality. Boastful people like to boast about themselves, about their abilities, about the riches, about their intelligence, or whatever. They again need excessive admiration from other people and approval from other people. Now, again, I have an example, clinical example. This 45-year-old man admitted to the ICU after a myocardial infarction, and psychiatrist is called because the patient is trying to leave. The reason for him to leave is he thinks he is not treated, he should not be treated in this manner. He should be treated better because he's important than other patient. He's special, right? He deserves special treatment, and in the hospital or in the ward, he has been given the usual treatment, and he's not happy about that. He says he's a small business owner, but he's on the way up, and as soon as people realizes his potential, he will be a millionaire. He cannot understand why the staff will not bring food from outside cafe for him, because the food in the hospital is bad. Right? Why can't they bring food from the cafeteria outside? Because I'm special. That's the way of thinking in narcissistic people. Self-importance. Now, this one I got from somewhere else. I thought it was quite explanatory. It compares histrionic personality with narcissistic personality. The underlying problem is the same in both conditions. There is a self-inadequacy, a feeling of inadequacy in both disorders. This group behaves in a very seductive manner, attention-seeking manner, physically trying to get attention physically by dressing up seductively, and they could be flirtatious. The other group has the same problem, self-inadequacy, but they try to cover it up by coping with an exaggerated sense of self-importance. They do it because the society, mostly the histrionic personality is diagnosed mostly, histrionic personality disorder is mostly diagnosed in women, and narcissistic personality disorder mostly in men, because even though they have the same underlying problem, they behave differently because the social norm is that. The social norm in certain cultures is for females to behave seductively. It is accepted when a female behaves seductively, little flirtatiously. And when a man boasts about his abilities, his intelligences, riches, everything, that is quite accepted to a certain extent. So they behave in the socially accepted manner, even though they have the same underlying problems. So I thought it's quite interesting comparison. Now, when it comes to you as medical students and us as doctors, one of our main issues is how to assess the personality. Now, in your history taking template, the model, in the history taking model, there is a place called pre-morbid personality. How do we do that assessment? Now, asking questions about pre-morbid personality from a patient may not be very helpful, right? If you ask the person, how were you before you got this illness? For example, let's say you ask a depressed person how his personality was before he became depressed. He won't be able to answer in a reasonable manner. One thing is, as I said earlier, we don't have a very good understanding about our own personalities. Other people who judge us for our personality. Other people are better judges than ourselves. Secondly, these people are at the moment acutely either depressed or manic. So when they're in a different stage of mind, they will find it very hard to tell you how they were before the onset of the illness. Let's say I am depressed now, and I look at things in a very negative manner, right, pessimistic manner. Therefore, even if I had some, let's say, cheerful personality traits, if I was a very sociable person before the onset of depression, I would not be able to recollect it or to tell the doctor that I was a sociable and cheerful person before this episode, because at the moment I am depressed. So it doesn't come to my mind at this particular point of time. So asking questions from the patients when they are ill may not be effective in identifying pre-morbid personality. So what we can do is, when the patient tells us their story, let's say the history of presenting complaint, or when we conduct mental state examination, we are better able to get clues about their personalities. Now, for example, I gave you some clinical examples. This man, he says he should be treated in a better way, right? Because he is special. He won't say that I have narcissistic personality traits. I think I'm a special person. So he won't say it that way. For him, it's not a disorder. It is the reality. So when he tells you about his problems or her problems, the personality traits will come up in the history of presenting complaint. So you should be able to detect those personality traits in the history or in the mental state examination. That's how you identify the pre-morbid personality traits. It's not easy, but with practice you can do it. First, you have to have a good idea about different personality traits and disorders. That's why we discussed signs and symptoms of different personality disorders that we encounter frequently in our clinical practice. That's how we do that assessment of pre-morbid personality, not by asking direct questions. That's not quite helpful. That's all I have for today. The cluster A personality disorders, paranoid, schizoid, and schizotypal, and cluster C personality disorders, dependent personality disorder, avoidant personality disorder, obsessive compulsive. Those things we will discuss in another lecture. I will stop here, and if you have questions, you can ask. You can type or ask or whatever. We got 5 minutes. Okay. Shall we stop then? We might have a live session sometime later when the conditions are better to discuss problems.
Okay, sir.
Right? All right.
All right,
Thank
sir. All
you
right, sir.
for coming. Thanks.